You're listening to Beat Autoimmune and Thrive, the podcast all about reversing and preventing autoimmune conditions so you can live your most vibrant life as soon as possible. We talk about autoimmune root causes, actionable solutions, and inspirational healing stories. I'm Palmer Kippola, and I used to have MS. Today, I'm an author, a speaker, a functional medicine certified health coach, a pickleball player, and nature lover who's helped thousands of people reclaim their health and their best lives. Let's dive into this episode. Welcome to Beat Autoimmune and Thrive. I am super excited about today's interview because I am joined by Dr. Aimie Apigian, a leading expert on the biology of trauma. Dr. Aimie is a double board certified physician. She's got 2 master's degrees in biochemistry and public health, and she has expertise in neuro-autoimmunity, nutrition, and genetics for addictions, mental health, mood, and behavioral disorders. She also holds several certifications in various trauma therapies, including the Instinctual Trauma Response Model, Somatic Experiencing, and NeuroAffective Touch. Dr. Aimie came to this work from her own personal experiences, adopting 4-year-old Miguel from the California foster care system and surviving her own severe health crash and burnout. I'm honored to have been on her wonderful Biology of Trauma Summit and podcast. And if you don't know Dr. Aimie, you're in for a treat, as she is the authoritative voice at the intersection of functional medicine and trauma healing. Welcome, Dr. Aimie.
Thank you, Palmer. It's always good to see you. And I'm very excited for this conversation as well.
I am too. It is so necessary because this is such an overlooked topic. I think even functional medicine doctors, root cause practitioners miss trauma. And as you'll soon see, this is not a topic that people with autoimmune issues can ignore, because there's a saying that the issues are in the tissues. That is until we release them. And you're going to learn a whole lot about that from Dr. Aimie. So
let me just share something briefly with you to people to understand the impact of this. You know, I'm in the somatic trauma therapy world. And the last little training that I went to, I like to go just to kind of, hang out with those people for a little bit. And the most common thing that I heard them say was, we are seeing more and more autoimmune, they call them clients, right? Because they're therapists, but we're getting more and more of autoimmunity, and we don't know what to do with that as trauma therapists. And I just released a podcast episode this last week. The latest one that I released was on just this very thing, like autoimmunity and trauma therapy, because there is such a strong connection. Most people don't know that. And we've actually got to navigate the trauma healing journey a little differently when we have an autoimmune condition. So it's a big deal in this interface between autoimmunity and trauma.
I'm so glad you mentioned that. That is a perfect way to start. And I want people to go and explore your podcast. Can you say the name of your podcast?
My podcast is the Biology of Trauma podcast. And first of all, search for Palmer Kippola's interview on the Biology of Trauma podcast.
Yeah, fantastic. Well, that's a great place. And we'll put that in the resources so people can see that in the show notes. Let's start at the beginning. I love definitions. Can you please define what trauma is so that people can just get level set? What is it that we're actually talking about today?
That's a great place to start, Palmer, because I come from the medical standpoint, right? I'm a trained medical physician. I've been through anatomy. I've been through physiology. I went through general surgery residency 3.5 years, and then finally switched to addiction medicine. So I come from a very unique lens that is different than most people. So most people will think that trauma is an event, and they're looking back at their life and looking for a horrific event, because that's what we've been told that a trauma is. And that is not what trauma is. There is a trauma response in the body. And so the body experiences a trauma. And that experience can happen as a result of, anything, because it's just an experience of the body. And so what are those things that will create that experience of the body? It falls under 2 categories. And the first category is anything that is too much, too fast. And even just today on Instagram, one of my course members posted something around grief and how what she needed most to move through grief and not let it become stored trauma was time. Her body needed time. And in our fast-paced culture, that's the last thing that we have. And so oftentimes there is always too much too fast happening. And that can go back to our early childhood, where even if we are a more sensitive person and sensory stimulation happens too much too fast, or a relationship happens too much too fast, or whatever it is, there's this category of too much too fast that overwhelms our ability to keep up. It's like if I were throwing tennis balls at you, hey, that would be fun for a little bit until I started throwing so many at you that you're like, this is too much too fast. I can't catch all of them. And that's what life can feel like. And when the body has that experience, again, trauma is an experience of the body. When the body has the experience of this is too much too fast, it goes into a trauma physiology. The other category that elicits a trauma response in the body is too little for too long. And this is where we're experiencing deficiency. This is where we are experiencing inadequacy, where I don't have enough of something that I need. And I was able to hold on for a little while, but now it's just been too little for too long. And that can be connection, that can be touch, that can be love, but that can also be physiological things like magnesium, like zinc. And this is where we can start to talk about the biology factors that will create that experience of the body. So in summary, I would want your audience to take their eyes off of looking for an event and put their eyes on their body and ask the question, when has my body had the experience of this feels like too much too fast, or too little for too long, or what most people going through my courses say, Dr. Aimie, it's both. It's been both too much too fast and too little for too long.
Such a beautiful description and definition. I've never heard anybody describe it that way. And I actually, as you were going through this, I was coming up with my own, yeah, that sounds right. That sounds right. And then you went to the too little for too long. And I'm thinking neglect is part of this. So you can see as abuse is something that you can see. It's something that you can actually measure. But neglect, you can't measure it, right? It's very hard to measure. But I think probably a lot of people can relate to any of the above. And what I found so important when we were having a discussion beforehand is that you don't even have to remember one of these events or one of these experiences, because maybe you're in a pre-verbal mode. And that can also be true, right?
Exactly. And this is what we find all the time, where the body will have a story of trauma. And Palmer, that's really all we need to know. We don't need our brain to logically analyze an event or our life and say, well, okay, that qualifies for a trauma, or I remember that trauma. The body speaks trauma, and autoimmunity is one of those expressions of trauma.
I love that you said that, because that ties beautifully into the next question, which is, why is it crucial to have this discussion in the context of autoimmunity? So can you help me and everybody listening to this understand the connection, the profound connection to these traumatic experiences that may have happened even in utero, and the advent of autoimmunity even decades later, which is what happened with me and a diagnosis of MS at age 19.
Yes. And the earlier that we had those experiences of too much too fast or too little for too long, it starts our immune system adapting. And this is the beauty of the human body, is that we adapt. We adapt. And as the nervous system adapts, and the nervous system is what holds that trauma response. It holds the stress response and it holds the trauma response. So that's our nervous system responding to what it feels is the appropriate response given the circumstance. And whatever the nervous system is doing, the immune system follows suit. They are so closely connected, you can't actually separate them. And whatever is happening in the immune system is affecting the nervous system. And so this is what becomes the feedback cycle of autoimmunity, for example. As you have written in your amazing book, there are a number of factors that come together that are needed for an autoimmune condition to develop. And trauma is one of those. And again, by trauma, I'm not talking about an event. I'm talking about your body, your nervous system having the experience of overwhelm. When has it felt overwhelmed? And the earlier in life that it started to have an experience of overwhelm, the more that our immune system is set up to develop an autoimmune condition. There are different ways that our immune system can adapt to overwhelm. One of those being long haul syndromes, for example. The others being like metabolic syndrome, where we have insulin resistance, we have at least borderline high blood pressure, we have some belly fat that's starting to develop and won't go away. So the metabolic syndrome, the long haul syndrome, chronic pain, those are other ways in which our immune system adapts to an experience of overwhelm in the body. But if you have the right combination of factors, right, the perfect storm, those adaptations will lead to autoimmunity. And so autoimmunity is one of those expressions of the immune system has been adapting to an experience of overwhelm in the nervous system. And here's the key principle to understand is that trauma is not just something that happened in the past. If we don't know how to, and we don't complete our trauma responses as we go through life, they become stored. And so now that trauma physiology has become a chronic physiology in my body. And that is what creates these adaptations over time in our immune system, as well as other adaptations, especially in our digestive system, especially with our hormones, especially with our nutrients. There's a whole host of changes that happen to our biology. It's part of what I teach around the biology of trauma. And then what happens is that same biology, and let's just take autoimmunity as an example now. Autoimmunity feeds back and keeps our nervous system stuck in a trauma physiology. It keeps it stuck in an experience of overwhelm. How is that? Well, if you think of your own antibodies attacking yourself, that's a little overwhelming. So when we look at the elements, and there's very specific steps of how the body goes into a trauma response, there's this key step in that. And when we are in a stress, we have a critical line of overwhelm. And as long as we're under that line, we stay in a stress physiology where we're able to respond to that stress. But when we cross that line of overwhelm, that's when the body goes into a trauma response. And the trigger for that is what feels like, no, I'm not talking about reality here, what the nervous system was called neuroception, what we perceive subconsciously, unconsciously as an inescapable life threat. And that is autoimmunity. Autoimmunity is a life threat according to our nervous system because it is being attacked, or we are being attacked. Our cells are being attacked. Our nucleus is being attacked. Anti-nuclear antibodies. We are being attacked. That is a life threat according to our physiology, and it's inescapable because it's in my own body. It's not something that's outside of me that I can run away from. And so autoimmunity becomes, according to our own nervous system, an inescapable life threat and will keep us stuck in a situation and an experience of overwhelm in the body. And so what may have been an initial experience of overwhelm in our past has now become our present reality. And this is how we can identify if we have stored trauma is, again, not looking at the past, but what is my body doing now? What is my current present reality? Is my body speaking trauma today? That's how I know if I have stored trauma, not by looking at my past. So I love how you said that we don't even need to know the story. And it's true, we don't. When we just look at my patterns today will tell me if I have stored trauma. And autoimmunity is one of those patterns of a biology of trauma that tells me, I've got trauma. I've got stored trauma. My nervous system has gotten stuck in a chronic trauma state. And so that will become part of my healing journey from autoimmunity.
Okay, that was so beautiful. And you probably answered 3 or 4 questions that I had
I was
all
going to say, I
in
threw a
at
lot at
once. No, you did. And it was beautiful because what you did is you summarized this to be so hopeful. So I want everybody to be really clear on this. What Dr. Aimie just said, you don't need to know what happened. I have goosebumps saying this out loud. You don't need to know. And if you're questioning, because I have many people that question, I don't think I had trauma. I think my childhood was great. I don't feel like I had any trauma. I'll tell you what the clue is. How do you know you have trauma? If you're dealing with autoimmune symptoms, if you're dealing with mood disorders, right? Depression, anxiety, if you've got gut imbalances, if you have what I think I heard you say, insulin resistance, metabolic disorder, obesity, these are autoimmunity, significant clues. Like you don't need to go looking for more clues. Did I hear that correctly? Did you say that?
That is correct. Like those are the signs. You don't
Those
need
are the
more
signs.
clues.
You don't need more clues. You don't need to take a quiz. Welcome to the human race, because many of us, unfortunately, autoimmunity is growing at what, 20% a year? They say 80 million Americans and maybe 10% of the world's population, and it is growing and a pandemic. And so the super hopeful thing is that this is recoverable. This is, I hesitate using the word fixable because it sounds like a problem that you just, go to your whatever, the wood shop and get something fixed, or take it like your car to the shop and it gets fixed. That's not what we're saying. We're saying this is an opportunity to, and I want to make sure that I'm getting this maybe not right, but directionally right. Is this an opportunity to allow things to come up and out? It's an opportunity to take care of our nervous systems.
It's an opportunity to know what has been misdirected and to get it back on the right track. And if you don't choose to do this, there's no shame in that, right? Like we each get to decide that. That's the agency that we each have. Am I going to go the traditional route for autoimmunity, or am I going to look at the root cause? There's no shame in either one. You just get to decide what you feel most aligned with. And when it comes to the body and trauma and autoimmunity, I love how you're even struggling with those words. Like, do I use the word fixable? And what was so helpful for me, because I was also on an autoimmune path. I didn't get the diagnosis because I never broke out with the butterfly rash that everyone was waiting for, but I had the high ANA numbers, and I just got my numbers recently and they are still back in normal. Yay, yay. So just between your story and my story, right? There's lots of hope. So but our body is not broken. There's nothing wrong with our body. And that's where I started. I started with those thoughts of, I hate my body. My body's betraying me. What's wrong? Get it right. Come on, we got life to live and you're holding me back. And when I started learning how to apply the trauma work for reversing my autoimmune path, I learned that I needed to also shift that relationship with my body. And part of that was learning and understanding that my body adapted in just the way it was supposed to. Given the information it was receiving, both from my outside and my inside world, the diet that I was on, the toxins that I was being exposed to unknowingly, but our body receives all of this information and it makes the best decision at that time for how to best survive. And that was an important shift for me to realize my body did exactly what it was trained to do. My body's not broken. And I just get to feed it new information now, like we are safe now. Right here, right now, I am safe, and I'm going to nurture you with good, wholesome, organic food. And I'm going to nurture you with a felt sense of safety that I know how to provide for myself now through somatic work, through some parts work. I know how to support my immune system with some different lion's mane mushroom and magnesium. Like, I am giving it different information because I know that my body adapts to information. And so when I can give it different information, then my body and my immune system will adapt to that new information. Now, saying that, let me just make a big disclaimer that we can't just learn something and that be the new information, right? Like, we can't just read a book about how to support our immune system. We actually have to do what's in the book. We actually have to take those supplements. We actually have to change how we sleep. The information by itself will not change us. But when we take that information and we apply it to create a new experience for us, then I can have the experience of feeling safe, feeling supported, which is a very different experience from overwhelm. When I have the experience of overwhelm, my immune system is going to adapt to overwhelm. And for me and for you, that will be through autoimmunity. It's doing what it was trained to do. But when I can provide a new experience of safety, support, growth, and expansion that keeps it manageable, well, then my immune system will adapt to that experience. So we create new experiences for ourselves that literally is the information that our body in our own lifetime will adapt to.
I really love that. And I am drawn to ask you about the parasympathetic sympathetic contrast, because as I understand it, healing only happens in the relaxation response, in that parasympathetic rest and digest state. Most of us with an autoimmune disorder maybe have no idea what that feels like. Maybe we're stuck in that always on stress reaction. I don't even call it a response because that gives it enough time to respond to something. A reaction is there's nothing you need to do. Your primitive brain just hijacks and you are off to the races. And when we don't get enough time in that rest and digest parasympathetic, in fact, my Oura Ring now has a stress monitor. And I am telling you, you've got one too. All right. So this is a fantastic bio tracker for people that don't know it. OURA, a Finnish wearable, tracks your sleep, your movement, all that. Now it has this ability to track how often you're in the stress reaction time. And when I think I'm relaxed, guess again, because I've been stressed out. It says 12 minutes ago, you were stressed out. Really? I didn't feel like I was stressed out, but I was. So I'd like for you to touch on the parasympathetic, sympathetic, and anywhere you want to take it, because I think this is such a huge opportunity for those of us with autoimmunity to calm ourselves down.
I get so excited about this because I get to teach something that I was not even taught in medical school. And so your audience will get to be really smart. And we actually have 3 different states of our autonomic nervous system. I, probably like you, was only taught about the 2, parasympathetic and then stress, sympathetic. And the word for that has been like fight, flight, or freeze. And actually, that's no longer the most up-to-date information. And a lot of this, I'm going to relate it back to my good friend and colleague, Dr. Steve Porges. He brought us the polyvagal lens, and he developed that lens after studying babies in the NICU. And he realized, wait a second, there's a different response that their body's going into when they get overwhelmed. And it's not the stress. It's not the sympathetic. So there are 3 states of our autonomic nervous system, and autoimmunity is not even in the sympathetic. Autoimmunity is in this 3rd one that we haven't known about. And if we were driving a car, there can be 3 different modes of our car. One would be cruising down the road. Palmer, if you and I went on a wonderful drive, the windows are down. We're out in the country roads, music, we've got our favorite music playing, whatever your favorite music is. We've got it playing. We've got my dog Ahmad in the background. She's got her head out the window, of course, and that is cruising. That is our parasympathetic. And like you said, that is where our body can restore itself. And then we have a stress mode. And so if on this drive, you realize, Palmer, shoot, I had a meeting that I was supposed to go to, and I'm going to be late. And guess what? We put my car into sport mode and we push that accelerator down to the floor because now we're going to try to get you to that meeting on time. That is stress. And stress, just like my car, we are going to burn through fuel. Our fuel is called ATP. That's our energy currency. And we are going to be burning through that. If we really want the optimal gas efficiency, well, then we need to be in cruising mode. We need to be in parasympathetic. But when we really need to turn it on, thankfully, we have a sport mode in our body, and it's called the stress response. And we feel that rise in energy as adrenaline comes on. We have about 15 minutes of adrenaline. And then it starts to fall off and cortisol comes in to kind of finish the job and give us energy to complete that stress response. But here's what happens. Either again, too much too fast or too little for too long, and we run out of gas or the car falls apart because we're driving too fast. And all of a sudden, our attempts to make that meeting on time are made useless. And that is the trauma response of the body. When our attempts to respond to a challenge are made useless, meaning, and what this means for your audience is when they hear themselves thinking, it doesn't matter what I do, it won't make a difference. That is a thought that only happens when our body has shifted into this third state of our autonomic nervous system, which in my car is the equivalent of throwing on the emergency brake, and things come to a crawl. We may not be completely stopped, but things are at a crawl and we can't respond to any new stressors because we're at a place where it's like, it doesn't matter what I do. It doesn't make any difference. And if it doesn't make any difference, my nervous system is going to protect me by conserving my energy. It's no longer going to let me burn through fuel. Guess what it's going to cause? It's going to cause fatigue, because fatigue will make me slow down and conserve my energy. So the fatigue in autoimmunity is not from the stress. It's from our stress response being overwhelmed. And we realized there's nothing that I can do that will make a difference. And that's passing that critical line of overwhelm. And we go into this place of feeling heavy, fatigued, inflamed, depressed. And even though there can be that element of fear behind it, like what's going to happen now that I didn't make the meeting in time, right? It still is this place of, but there's nothing I can do about it. I'm stuck here. My car won't go anymore. I've either burned through the fuel and I have no more gas, or I broke the engine because I was pushing it too fast, right? I overwhelmed my stress response in my body. And so our body has a capacity. And I liken my capacity to my daily cup of tea or whatever cup, right? Whatever you drink, just look at your cup. That is the size of capacity that you have. You don't have a different size of cup today. You only have that size of cup. And you can only handle that much stress. And as long as the stress matches that capacity, you're good. And we actually need stress in our life. This is actually why our cortisol levels are naturally higher in the morning. We are intended to move into action and to have a daily challenge that we get to master and feel good about ourselves. So stress is not a bad thing. What happens though is when we overfeel the stress and our cup starts overflowing, not out of goodness and joy and abundance, but from all the stress that's hitting us, and we can't hold it anymore. And when it overflows, it makes big messes. Everything gets wet, everything gets dirty, and we're left feeling like we have no energy to even clean up the mess. That's the trauma response of the body. So it's the stress is not the danger. It's when we take on more stress or more stress hits us than what we have the capacity to deal with. And so our goal in the trauma healing journey is to be able to increase our capacity, because the more capacity I have, the more stress I can handle, and it doesn't overwhelm me. When we get overwhelmed and our body goes into the trauma response, that is when we will have a flare-up of our autoimmune symptoms. If it's just stress, we won't have that flare-up. If we are having a flare-up, that means that our stress capacity got overwhelmed. We crossed that critical line of overwhelm, and our body went into this place of, I can't keep up. I can't do all of this. That's not stress. That is the trauma response and how it relates to autoimmunity and actually being the trigger for autoimmune symptoms.
Beautifully explained. Thank you so much for that. I think a lot of people, in particular women, are 80% of the autoimmune issue, right? I mean, it's usually a woman, but everybody can be affected by this. And I think you've just spoken to so many people who can completely understand. And it actually, the way you've described it, I'm feeling like some of these feelings of heaviness and fatigue and just this crushing sense of there's nothing I can do, in some ways sounds like long COVID. These long haul symptoms, chronic fatigue syndrome, fibromyalgia.
Oh, and then you bring in Lyme and mold. And I mean, you can have a long haul syndrome from anything because it's not actually the immune system that's wrong. It's the nervous system that is overwhelmed and causing the immune system to adapt with a long haul syndrome.
I love it. I love it. So I love that you have defined this. And more than anything, I think our goal here with this conversation is to create a level of awareness in people that if I'm having these symptoms, this is my huge clue that I need to pay attention, that there may be some trauma response going on in my body. And I want to be really clear, this is not your fault. This is not your fault. Our bodies are meant to withstand a certain amount of stress. Your body is doing what it's designed to do. And part of that adaptation is part of what our bodies are designed to do. And when you talk about some stress being beneficial, the way that I've heard this from stress expert Heidi Hannah is that there is tame stress. And that's easy stuff. Like getting on a podcast interview, there's some stress, getting ready for a podcast interview, me getting prepared. Then there's something called tolerable stress, which is, boy, we all are going to face this, a death of a loved one, a divorce, some sort of big something that happens in your life. And if you have the support and you have the resources and the capacity, you can move through that. And then there's the toxic stress, which is harder to recover from, especially when you're already in a state of overwhelm. And I think that's what you've beautifully described is these different ways. And now I'm kind of chomping at the bit for how do we get out of this? How do we get out of this situation? What can we do? I know there's tremendous hope. I know you have healed and bounced back better. I know that. And you are offering people this beautiful free steps to identify and heal trauma on your website. And I really want to point this out, that there is a place to go to begin this healing work. So I would love for you to describe that. I don't want to miss anything else that you'd like to talk about, but I felt like this was a really good place for us to talk about solutions because yes, we've heightened everyone's attention to what the problem might be. And everybody's feeling like, oh, well, I got autoimmune symptoms. That means Dr. Aimie saying I got trauma. I want to do something about it.
We do want to do something about it because unless we do something, then nothing changes. Right. And we want change. And that's why we're here. And so I love how you said that really it's building awareness because I want people to be able to recognize that what I'm dealing with, I thought was stress. And that's why I kind of minimized it. I'd be like, all right, well, I'll do that self-care that I'm supposed to do tomorrow because I'm just stressed. And realizing, no, this isn't your body in stress. This is your body in trauma. Okay, that means I've got to take this a little more seriously. And what to do then? So I want people to be able to recognize the signs of trauma. Again, I do have this guide, and I think it would be very helpful because I go through the thoughts that you would know your body's in trauma response. I go through the body sensations, and I go through some different health symptoms and conditions that are all signs for if your body is in trauma physiology, not stress physiology. But then what to do? And for me, this was the most important thing because, yes, after I adopted Miguel, I figured out all the pieces that he needed, but then I got really sick. And part of that was with chronic fatigue and autoimmunity. And I didn't know what to do. I knew that I had some trauma elements, not because I saw trauma in my childhood. I didn't think that I had any trauma in my childhood, but my body, I had learned this was its expression of trauma. And I didn't know what to do. Even as a physician, I didn't know how to piece together the functional medicine piece, the biology piece, this trauma piece. And so believe me, Palmer, I feel like I did everything wrong in order to try to figure out how do I do this in a cohesive way? And I overwhelmed my body all the time. I would go and do trauma therapies and be so completely overwhelmed. I would be in chronic fatigue for 3 days. I mean, just feel completely out of it with no energy and trying to just get through work. So I realized, I'm doing something wrong. And that was when I really started working on developing what is the essential sequence that I need to put in order for my body to safely come out of this stored trauma, for it to feel safe for my body to open up these areas that are obviously feeling overwhelmed. And by overwhelmed, I mean terror, right? Like there were moments in my life where looking back, I'm like, my body experienced terror. My brain still doesn't really understand that, right? But my body is holding those memories of, I was so scared. The only solution I saw was to shut down and to open up those experiences, those sensations is scary for the body. And so how do I do this? And so that's why I created the essential sequence. And now I've walked even thousands of patients through this essential sequence who have some form of chronic health symptom. And we've got to do it differently than someone who doesn't have any health problems and they're just coming in to do trauma therapy. Even though they still should follow an essential sequence, it's not as important for them because they're not dealing with, I might cause a flare-up of my symptoms and be wiped out for days, for weeks, for months, depending on my condition. So the essential sequence is what I also lay out in this guide. Again, the steps to identify and heal trauma, because the body needs to have a process in which to do this safely. And what I love to do for people is to empower them to become their own safe guide. And I teach them how to do that, because I don't want them to depend on me. I don't want them to depend on a therapist. I want them to learn how to be their own safe guide to safely open up their own body and process things and keep things manageable within their capacity for that day and learn how to navigate all of that.
How to navigate and to build capacity, as I heard you say it, building capacity.
Yeah.
So in that regard, we're always on this journey of how can we expand our capacity and how can we return to that place, that feeling of safety that we have created. Did I get that right? No one else.
We learn how to create. No one else.
We learn how to create for ourselves, because at the end of the day, not a functional medicine doctor, not a naturopath, not a trauma expert can do this for you. You can be a guide, and you're a wonderful guide, Dr. Aimie.
I love safely guiding people through this journey. I mean, I just love it. I start with a foundational journey that teaches them how to build that foundation of regulation. And it's a journey into their own nervous system where we get to explore, what do these 3 different states actually feel like? And yeah, you're probably not even at all near parasympathetic at all to start off with. You're probably either in sympathetic or down in that shutdown and freeze response. What does that actually feel like? And how can we safely come out of that? And to watch them learn these skills. And so many, Palmer, tell me, I had no idea that I didn't feel safe. Like my brain, I live in my brain a lot, and I thought that I was safe. I had no idea that my body was telling me, I don't feel safe, and you're not listening to me either.
I like to say our bodies are just messengers. They just give us messages, letting us know that something is out of balance, something is off, But how often do we take the time to really listen, to give our bodies what they have been waiting for?
Yeah.
And you know what? There's no downside. I'm thinking like, what is something that could happen that's bad? I don't see a downside here.
Well, I'll tell you what most people are afraid of. Most people are afraid of that if they actually listen to their bodies, they're going to experience more pain and more fatigue, because that's what they feel. And so they're trying to numb that. They're trying to not feel that. They're trying to not be in their body.
Right.
Not realizing that we can learn how to do this in a safe and manageable way that won't have you falling apart in the meantime. But unless you want to spend the rest of your life trying to avoid those sensations that you can feel are beneath the surface, this is the path to health, to a sense of safety, which means connection, authenticity, belonging, all of those things that are on the other side of this. But we do need to learn how to do this safely and not just jump off of a cliff, the emotional cliff, and hope that everything is going to be okay. Because when we have an autoimmune condition, most times it will not be okay. We will crash at the bottom if we aren't learning how to do this safely and open up our body.
I'm so grateful for you and for the wisdom and sequence that you're sharing for people to be able to do this safely. And I really want to encourage you, if you haven't done it yet, go to Dr. Aimie's website, which is traumahealingaccelerated.com, traumahealingaccelerated.com. And on that website, you will see steps to identify and heal trauma so that you can safely open up that stored trauma, release it. And I promise you, this is from my own vantage point, I was terrified to go through this journey because I thought there was going to be a boogeyman in the basement. No, seriously. Like lots of trauma from childhood. Birth mother was 14 years old, being bathed in stress chemicals, came out, I got to do this myself, to be able to let my guard down, to be able to heal safely. And I can tell you that Dr. Aimie's work it's like magic, because it feels like it's going to be some overwhelming process. But what it turns out to be, it's kind of like the Wizard of Oz. There is no bad, the wizard, there's nothing there. There's nothing there. Mm-hmm. It's a safely guided journey back to who you truly are, authentically you. And there's nothing like knowing that you are worthy, you are enough, you are deserving, and you're perfect the way you are. Nothing needs fixing. Dr. Aimie, this has been a lovely conversation. Would you like to please have the last word on anything else that you would like to share that I didn't ask you or that you feel compelled to say?
My last words will always be that there's hope. There is so much hope. And when we do this in a deliberate, intentional, strategic way, that's where we can learn how to do this and be able to have a different experience even around therapy or trauma work than what we've had in the past. It can be a very different experience when we know what we're doing, when we have a process to follow, when it is based on the science of the body and the states of the nervous system. It doesn't need to be what we're afraid that it will be, or what the experience that we've had in the past. There's so much more that we have to be able to experience.
Beautifully said. I'm so grateful for you. As I said, I'm grateful to call you a friend. I can't wait to continue the conversation. Thank you for being here, for sharing your wisdom and your heart, Dr. Aimie.
Thank you, Palmer.
Be well, my friend. And that's a wrap. Thanks so much for tuning in. If you enjoyed this episode, be sure to subscribe, share it with your friends and family, and if you feel inspired, please leave a quick review so other people can find it too. Now, if you want to beat autoimmune and thrive, make sure you sign up for my free video training at freeautoimmunetraining.com. That's freeautoimmunetraining.com, and watch the first video right away. Take good care. Bye for now.